For the first time in central Queensland, future doctors will be able to complete their studies locally. Year 12 student Jay Warcon is putting together his application.
I might be like one of the first Darumbal doctors, so that'd be pretty cool, and I'd be able to, since I'm Indigenous, I'd be able to probably like relate to the Indigenous more than other doctors could.
The CQ University and University of Queensland partnership aims to address doctor shortages in regional areas.
The partnership will benefit the regions by enabling up to 40 doctors a year to be educated and trained within the central Queensland and Wide Bay regions.
The peak body representing medical education and training says more needs to be done to encourage Australian-trained doctors to work outside the capital cities.
Things are out of balance.
A problem that's been amplified by international border closures.
The impacts upon people coming into the country means that we don't have that safety valve, the ability to rely on doctors from overseas.
Regional areas like Rockhampton rely heavily on international medical graduates who must work in locations with workforce shortages during their first 10 years in Australia.
I think it's a really good opportunity. I think especially for a lot of kids who grew up in town or maybe even from smaller towns outside of Raqeeb, that step from high school to university can be really big, especially if you're moving hundreds of kilometres away to a big city.
The program will begin in Bundaberg and Rockhampton next year. Jasmine Hines, ABC News, Rockhampton.